Let's now discuss severe pain in joints of fingers, shoulder, and knees under P syndrome. This is case history. A 42-year-old woman complained of severe pain in the joints of the fingers, shoulder, and knees. The joints were also swollen and felt hot to the touch. This had started 4 months previously after planting 100 trees in her garden. It started with pain in one finger only, then spreading to all fingers, which also became swollen. At that time, she also felt cold, lost her voice, had a sore throat, a temperature, and felt generally achy. Since then, she had a recurrent sore throat every 10 days, accompanied by ache in all joints. All her muscles generally ached and felt heavy. She felt lethargic most of the time, and she put on weight. Her tongue was red with a thick, sticky yellow coating. The coating was thicker in the lung area, that is, just behind the tip. Her pulse was rapid and slippery. This is a clear case of heat painful obstruction syndrome. Originally, when her symptoms started in February, she suffered from invasion of wind cold damp in the joints. Wind because the pain started in one finger and moved to other joints. Cold because she felt cold, and damp because the joints were swollen. She also had symptoms of invasion of wind cold in the lung defensive chi portion, aversion to cold, temperature, sore throat, and ache in muscles. After some time, cold turned into heat, dampness settled in the body, and the condition turned into heat painful obstruction syndrome, characterized by dampness, swelling of joints, and heat or hot joints. She also had general symptoms and signs of damp heat, such as achy muscles, feeling of heaviness, lethargy, weight gain, a sticky yellow tongue coating, and a slippery rapid pulse. She also had signs of a residual pathogenic factor in the form of wind damp heat, as evidenced by the recurrent sore throats and the thick yellow coating in the lung area on the tongue. This latter sign usually indicates the presence of a residual pathogenic factor after an exterior invasion that has not been cleared properly. She was treated with acupuncture, and the treatment was aimed at clearing heat, resolving damp, and removing obstructions from the channels. The main points used were Li11, stomach 43, and Do 14 to clear heat, spleen 9 to resolve dampness, Li15 and Bashi points as local points. All the points were needled with reducing method since the condition was still fairly acute and the pattern still full on the whole. She made a complete recovery after 21 weekly treatments. Thank you for your attention.